things go awry, whether it's chronic pain, mobility issues, or other serious concerns, and non-surgical treatment fails to make one better. That may mean therapy, injections, anti-inflammatory medications, when that's just not getting the job done. Spinal surgery may be the best option to stabilize the spine or to relieve compression and maintain motion. Today, we'll explore how surgery such as discectomies, laminectomies, fusions, and disc replacements can help you get back on your feet, as well as answer your questions on this episode of Ask the Doc.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I am Dr. Georgiy Brusovanik, a minimally invasive spine surgeon. Let's start things off with a question from our Facebook page. This one is from Lenny. Lenny asks, "Hey doc, I hurt my lower back a few years ago reaching for something on a high shelf. Anyway, it's begun causing numbness in my legs and my orthopedist says I need surgery. Doc, I hate getting a shot, much less getting cut open on an operating table. Is this absolutely necessary?" Lenny, I'm really sorry to hear about your current situation. And if your legs are in pain or are numb, it's reasonable to consider surgery. I'll do what I can to allay your fears. Thank you for your question. I just want to mention one thing. You mentioned going to an orthopedist. Many may not know whether it's better to have your back or neck looked at by an orthopedic spine surgeon or a neurosurgeon. The truth of the matter is, in 2024, everyone who treats spine should be going through a fellowship, whether it's orthopedic surgeons or neurosurgeons. It's rare that someone would come out from general orthopedic or general neurosurgical training with sort of the newest and the greatest in how to treat spine. You really want somebody specialized. So I hope that the person that you saw, Lenny, was an orthopedic spine surgeon. And I can't tell you what's better, orthopedic spine surgeon or a fellowship-trained neurosurgeon. It's a personal matter. It's whether you can connect with a doc. It's whether they can answer your questions and give you that comfort that you would really need before agreeing to, quote-unquote, go under the knife. So, is surgery absolutely necessary? Is a difficult question. Most of the time, when I hear patients are told that they have to have surgery, I find that I want to argue. I find that it should be the patient saying, I want surgery and I want it yesterday, as opposed to the doc telling you, hey, Lenny, if you don't have surgery, you'll be paralyzed. You better get this done. There are very few conditions in the human spine that if you leave it alone, you'll become paralyzed. Nobody has a crystal ball. And even with spinal cord compression from disc degeneration or deformity, it's often not an emergency operation. It should be an elective operation, meaning it should be when the patient fails conservative care, confirms the diagnosis vis-a-vis properly targeted injections, and says, I can't live like this. In my practice, that's what determines whether you can consider or should consider spine surgery. It's very rare that you have to go under the knife, Lenny. And if you feel like your doc is pushing you towards surgery, I would really advise you to get a second opinion. I'm happy to take a look at your films if you want to mail them over. I hope this helps. Our next question comes to us from Myra. Myra reached out to us on our YouTube page. Myra's question is, Dr. Brusovanik, my adorable but aged parents have always done everything together, and now, as fate would have it, have both been diagnosed with osteoporosis and spinal fractures. What kind of treatment can we expect for them? Myra, thank you for sharing your story and thinking these thoughts about your parents. My prayers are with your parents, but the reality is that most osteoporotic related compression fractures are not dangerous, they're painful, but most do get better on their own. Now, we have had some amazing innovations in the world of spinal fractures. For example, I do a procedure known as kyphoplasty, where a needle is introduced through the skin into the bone, a balloon gets inflated, and that allows me to inject a bit of cement. That cement will stabilize the bone, and usually when a patient leaves the table, which is about 30 minutes later, they'll say that their pain is actually gone. But before I say too much, let's take a peek at a video from our partners at Baptist Health.
The whole idea of osteoporosis is that bones are weaker than they're supposed to be. So instead of falling and really hitting yourself hard with something that should cause a fracture, we see that our patients are either having very minor falls or no fall at all. They bent over, or they did something like picking up a gallon of milk, and that causes a fracture. So by definition, if anybody has what we call a fragility fracture, where they did something that shouldn't have caused a fracture in anybody else, and it caused a fracture, they should come in and be evaluated for that. The other thing that's very important is loss of height. Our elderly people think, and the community in general, they think that losing height is a normal part of aging. And to a certain extent, they're right, but if you lose more than average, that could be a sign that it's because you're having osteoporosis. And another thing is when people have what we call in the medical community kyphosis, or like people are bent over, that's not just like regular aging. That's because you're having the silent fractures in the back that are a sign of osteoporosis.
I really hope you take from this video that compression fractures can cause pain in different ways, either due to kyphosis, meaning that forward flexion, or from just a fracture itself. But all of the above is fixable, yet it's just not enough. It is very important, and I'm really glad, Mari, that you asked this question. It's very important that your parents seek an advice of a rheumatologist and get the proper medical treatment for osteoporosis. There are some amazing innovations in medical treatment that results in actual strengthening of bone. And I would highly advise you or any of our listeners who have encountered this problem, seek advice either from an orthopedic surgeon or a rheumatologist and find a way to strengthen your bones so that you prevent further fractures in the future. Okay, Ali reached out to us on our YouTube page, and her question for me is, hi, Dr. Brusovanik, my name is Oliver, but you can call me Ali. I'm scheduled to get a spinal fusion surgery in a couple of weeks, but I was kind of checked out when the surgeon told me what that entails. Now, as the surgery gets closer, maybe I should rethink the whole thing and put it off for a while. Ali, it sounds like you are appropriately stressed out about spine surgery, and it's understandable, but I'm going to offer you some advice, as well as share some positive surgical statistics, which I hope will put you at ease. Spine surgery, especially minimally invasive spine surgery, the risk factors are low, let's say about 3% range, as compared to the big classic spine surgery, where the risks were as high as 36%. So it's important that your surgeon does abide by new understanding of spinal pathology and really performs the most cutting edge, the most careful operation, which really defines minimally invasive spine surgery. But I think a more important question to ask, Ali, is do you have to have spine surgery? Have you truly maximized conservative care like proper injections? And is your quality of life so impeded that surgery is the only option? Now, if it is, let me complicate the answer even more. You are having spine fusion surgery. That means a loss of motion at a deformed segment. Usually spine surgery is done for deformity, but it does carry some long-term risk to discs above and below. So it's important that you discuss with your surgeon if spinal fusion is the only solution. Still, spinal fusions are the most common operations, and with the recent advances and about 20 years of excellent research, disc replacement has taken over that position where we can really fix somebody with a degenerative disc without losing motion and without having to think about further spine surgery in the future. I'm so glad you asked that question. Please go back to your spine surgeon and ask him about, or her, about all these important points: minimally invasive, motion preservation like disc replacement, and finally, is surgery absolutely necessary? Thank you for this really great question. In case you missed it the first time, here's another opportunity to find out how you can submit your questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Reina sent her questions via our own website, allhealthtv.com. Reina asks, Dr. Brusovanik, I'll be going under the knife in about a month for nucleoplasty. And like the last person, I'm having second thoughts. My sister-in-law, Eunice, said I should get a second opinion about surgery because I have diabetes, which could be a problem because of something called comorbidities. So comorbidities, that means medical conditions that may complicate a good outcome or lower the chances of a good outcome. So diabetes is definitely a factor. It interferes with one's ability to heal, and diabetes is even associated with a higher infection rate. Now, diabetes shouldn't stop you from having surgery. It just means that your doctor has to be that much more careful and work in conjunction with anesthesia to make sure that during the surgical period and then the recovery, your blood sugar is as much normalized as it is possible. You may even consider going on insulin with that regard. Now, I'm with Eunice. You should get a second opinion. And Reina, going under the knife is an important step, but nucleoplasty is a procedure that has actually fallen out of favor years back. Now, this procedure involves essentially burning the nerve. And back then, surgeons thought that a degenerative disc should be sort of burned from inside, which would allow it to hurt less. Now, this has since been proven to be wrong. And if you are having back pain, please make sure, Reina, that first you maximize conservative care. Injections are a godsend for so many patients to avoid surgery. And these injections will also help confirm which one disc is causing your pain, because it's usually just one disc. Now, instead of burning that disc, you could just take away the inflammation with a shot or replace that disc. And if it's a deformed disc, fuse that disc. But I would strongly urge you, just like your sister-in-law, please seek a second opinion. Great question again. Thank you. All righty. We've got another question, and this one is from allhealthtv.com. You should really check out this website. It's chock full of very important and useful information. Milo asks, hey, Dr. B, my orthopedist recently told me that I'm a good candidate for a discectomy. Yay for me. I'm sorry, Milo. Guess I'm a little bit of a surgery scaredy cat too, because I'd like to know what some of the risks are associated with spinal surgery. So, Milo, super good question. Anytime you cut the skin, there's a risk of an infection. And if you have an infection, you'll have to go back to surgery to wash out that wound. Now, that's rare, especially with minimally invasive spine surgery and a proper prep, but it's still something to consider with any operation. Bleeding. Anytime that skin is cut, there's a risk of bleeding. And especially with spine surgery, since there's so many important blood vessels deep inside around the spine, it's possible to have a bleeding episode, and it'll be very important to address that and to be ready for that. Operating on the wrong level, because sometimes surgeon may see a problem on an MRI, but it's actually the second worst, or rarely even the third worst disc that's actually causing the pain. And there's a way to avoid this mistake by having proper injections before surgery to confirm where the problem is indeed. A more common issue, though, specifically related to your question, Milo, is a discectomy indicated because discs degenerate and parts of it herniate. So you may get an episode of a herniation superimposed on top of a chronic history of back pain. So somebody who has never had back pain suddenly has pain when they cough or sneeze, pain going down the leg, and it's been less than 6 months. That patient likely deserves a discectomy. But if you've had chronic back pain, difficulty sitting for too long, difficulty to stand, pain going down the legs, intermittent, when you get out of the car, you're like an old person kind of flexed forwards. That sounds much more like a chronic degenerative disc problem. And what I see often happens is a patient with a chronic problem like this will have a discectomy, come back and say, maybe my leg is better, but I'm still having back pain. So if you've had pain for more than 6 months, the likelihood is that a disc replacement will be more indicated than a discectomy. So Milo, it's important that you analyze what I'm telling you. And if you find that your surgeon is rushing you into a quick and easy procedure, it's still spine surgery. So if you've had chronic pain, make sure you talk to your doctor about a solution to that as well, which may be a disc replacement. There's nothing wrong about being anxious about surgery. And all of these questions are so relevant. Nelson Mandela used to say, I learned that courage was not absence of fear, but triumph over it. And really the only way to triumph over fear of spine surgery is to ask more questions and make sure that the final conclusion is something that's well verified and something that you really believe in, that your surgeon really believes in. The next YouTube question comes to us from Ali. Ali asks, hi, Dr. Brusovanik, what are the potential benefits of minimally invasive spine surgery compared to traditional methods? Ali, thank you for sharing this question with us, and you've come to the right place. But before I share my knowledge about minimally invasive spine surgery, let's check out the following video from the Mayo Clinic.
The goal of minimally invasive surgery is to minimize the damage to soft tissue around the spine. Most surgeries fall into one of 3 categories. The first category is decompression surgery. With decompression surgery, we're making small incisions to go down and remove tissue that's pressing on the spinal cord or nerve roots. Another type of surgery that we do is called disc replacement surgery or arthroplasty surgery. A third type of surgery that we do is called spinal fusion surgery. With spinal fusion surgery, we're trying to fix 2 or more bones together. To do this, we need to place, most of the time, some sort of instrumentation into the body. And that includes rods, screws, plates, sometimes cages into the disc space. To hold those bones together, our goal for every patient is to help the patients recover quickly and get back to life as quickly as possible.
I think that's a really great video. And I just wanted to show you, the doc is talking about screws. Here's an example of a screw, a big tower, this part that sticks out of the skin and then gets broken off, and finally the actual screw part that goes into bone. Now this can be placed with a classic big wide open technique where the spine surgeon strips your spine off the muscle, or minimally invasive with use of navigation, computer assistance, or tubular retraction. Here's an example of a cage. This kind of a plastic cage gets filled with bone and gets placed in between bones where you are trying to achieve a fusion. Now, and again, this can be placed with a big wide open exposure, or it can be done minimally invasive. Minimally invasive essentially summarizes a way to operate that limits injury to the body. So whether it means tubular retractors, microscope, computer assistance, it's all about minimizing the damage as the spine surgeon tries to reach your spine. Thank you for this question. If you have questions, we've got answers. And just in case you missed it the first couple of times, here's how you can submit more questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Ning sent a question to us through our Instagram page. Ning's question is, Dr. Brusovanik, what symptoms are immediate indicators to you that this particular patient is going to need surgery? And are they only located in the back? Ning, that's a really great question. And really thank you for asking this question. So immediate need for surgery is very rare, exceedingly rare. An unstable spine after a car accident, that needs an operation because if that patient gets up, they'll be paralyzed. Impending paralysis, like loss of bowel and bladder function, that's something that should be addressed within 24 to 48 hours to give a patient the best chance to recover. Otherwise, it's rare to see that a patient needs an emergency immediate operation. However, there are things that may push me to say that there's a high likelihood that you may end up with an operation or you should really consider surgery. So this list, albeit perhaps incomplete, includes: 1, pain that goes to your arms and legs. I'll hear from patients all the time saying, I've lived with this pain for years, but now this new pain I can't tolerate. And that new pain is usually nerve pain. You can sort of get used to back or neck pain, but when there's nerve pain, it's just impossible to ignore it. And if you can't sleep, you can't work, many of these patients end up with an operation. Constant back pain could be an indicator if you've had enough, if your quality of life has deteriorated. But so many patients live with constant back pain without ever having surgery. It's hard to say that that's a strong indication. Reduced mobility as well. Look, stenosis or narrowing of the canal will make it so that it's very difficult for you to walk without sort of flexing forwards. You may find that sitting is the only way that you are pain-free. And it's an easy solution. You can just do a minimally invasive decompression and you will walk better that same day as surgery. But do you have to have an operation? I think that if the reduced mobility is becoming a big factor, if it's ruining your quality of life, if you are getting overweight, depressed, then yeah, reduced mobility can definitely be a reason to fix the problem. Now, numbness, weakness, or burning sensations in the leg are also indicators of nerve symptoms. And whether it's in your legs or in your upper extremities, that's usually what leads patients to surgery because these kinds of pains are impossible to ignore and there's just no medication that can make that better. A spinal deformity that's progressing can also push one into surgery, specifically in elderly where the scoliosis becomes decompensated, meaning that the head is no longer above the pelvis, they are leaning either sideways or forwards. These patients are in a world of pain, and this kind of a pain won't just get better on its own. And as I mentioned earlier, spinal fractures sometimes necessitate surgery, although most of the time, even something that sounds so scary as a spinal fracture can be managed either non-operatively or with an elective operation, not making it into an emergency. Our next spine-related question comes from Lupe. Lupe reached out to us from Facebook. She asks, Buenos dias, Dr. Brusovanik. My mother is scheduled to get back surgery in a couple of weeks, and I'm curious about what types of pre-surgical evaluations and tests are typically required before spine surgery. Lupe, I love that question. I appreciate it because it's so relevant. Now, you want to make sure your blood clots properly. You want to make sure that you have enough hemoglobin in case there's blood loss and that there's no underlying problems. So that deserves a coagulation study and what's called a CBC, a general metabolic panel. So that's labs, blood work, and that's almost a standard thing to do before surgery. Now, we also want to know whether your heart and your lungs can handle an operation. And from that point of view, it's important to see a primary care doc who will check your lungs, perhaps order an EKG, or even refer you to a cardiologist. Kidney function will be assessed with labs as well. But between labs and an evaluation by your primary care doc, you should be able to find out whether you are safe for surgery. I guess it's an all health TV kind of a day. And our last question is from Gita. Doctor, my husband Gerard was born with scoliosis and it slowly progressed over the years. Does this mean he's going to need surgery? Gita, that's a great question. It's hard to predict whether somebody will need surgery. And even with progressive scoliosis, if one part of the spine is crooked, but the other part of the spine can compensate, then these patients should not have spine surgery. Oftentimes, patients with scoliosis can be better with an injection, specifically facet joint injections. These are injections that address pain coming from the very joints that become incongruous with the incongruity of scoliosis. Talk to your doctor about facet joint injections if you have pain with scoliosis or any kind of deformity. Never rush into surgery. But if surgery is indicated, and if you feel like your surgeon is pushing you to have an operation, please, please, please get a second opinion. Well, that's it for this episode of Ask the Doc. You guys have asked some amazing questions, and I'm sure that they've been relevant to a large population of our viewers. Remember to ask questions to your doc as well. Even if you feel like surgery is indicated and you gotta have it done right away, it's better to measure 3 times before you cut once. If your doc is talking about fusion, screws, rods, immobilization, talk to them about disc replacement. And if your surgery is being pushed on you, please get a second opinion or send me the imaging, and I'm happy to talk to you as well. Thank you for visiting us on this episode of Ask the Doc, and please send us more questions. Until next time.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.